Most people with swollen, painful hands are told the same thing. It's arthritis. Take ibuprofen, come back in 6 months. What they're not told is that there are three completely different diseases that all look like arthritis from the outside. And one of them is destroying your joints right now, even while you're managing it. I see this mistake every week. And in the next 7 minutes, I'm going to show you exactly how to tell them apart. Because the treatment is completely different. And the window to protect your joints is not unlimited. I'm Dr. Neha, a rheumatologist and lifestyle medicine physician. Let's dive in. First, look at your hands right now. So the three types of arthritis that commonly affect the hand, they show up in different places in your hands, in your fingers. For example, osteoarthritis, that's the one that you may have heard of, is the wear and tear arthritis. It shows up at the joint that's closest to your fingertip. So kind of like over here, the very tip joint. And you may also notice some bony bumps that are forming there, and they're called Heberden nodes. OA is extremely common after 50. It's uncomfortable, but not an emergency. Another common spot is right here at the base of the thumb. Rheumatoid arthritis, though, shows up very differently. The swelling is usually in your knuckles, the big knuckles at the base of your fingers, and then the middle joints as well, not the tips over here. Like I said, those are osteoarthritis. And they tend to mirror each other, the same joints on both sides. Not always, you could have like a third finger here and a second finger here, but it's something that's mostly symmetrical. Now, the third type of arthritis is called psoriatic arthritis. Psoriasis is a skin disease, and this can look like that. Usually what happens is you have the skin symptom first, the psoriasis rash, and then you can get psoriatic arthritis, which is about 30% of the people who have that skin rash. Now, sometimes people present backwards and they have the arthritis first and the rash afterwards. That can happen, and it's frustrating because it takes even longer to get diagnosed. But the characteristics of psoriatic arthritis are different than rheumatoid arthritis, especially because there's one feature that's really hard to ignore. The entire finger can swell, and that finger can look like a sausage. That's why we call it a sausage digit. It can also happen to your toes, and it's called dactylitis. And remember, if you don't actually have that skin rash, nobody will even stop to consider this. Now, the stiffness test, and you can do this yourself. In osteoarthritis, morning stiffness is more brief, about 15 to 20 minutes in the morning, and then you kind of loosen up. I know it sounds like a long time, 15 to 20 minutes, but it's not usually as long as rheumatoid arthritis or psoriatic arthritis, because that stiffness in your joints can last an hour or more, sometimes 2 hours, or you can just wake up and the entire day you feel stiff. And your hands kind of feel like they belong to somebody else. That prolonged stiffness is actually one of the flags that we look for, rheumatologists especially, and most people are never told to even pay attention to this. So the two big important questions are, where is the swelling, the location, and how long does that stiffness last? Those two things alone can tell you a lot. And the rheumatologist will always ask, but you don't always often start off seeing a rheumatologist. Now let me tell you what's happening inside a joint, because this is why I keep saying, don't wait. Your joints have a lining, and it's called the synovium. In a healthy joint, it's paper thin. Its only job is to make a small amount of this lubricating fluid. And in OA, the immune system attacks that lining. It becomes thick and inflamed. It floods the joint with this inflammatory fluid. That's the swelling and warmth you feel. Like when we teach our medical students, we'll ask, is it red, hot, tender, swollen? Those are the features of inflammation. But here's what most people don't know. It doesn't stop there. That inflamed tissue, it starts invading. It grows into the cartilage, it grows into the bone, it produces enzymes that literally eat away at the joint structure. We call this tissue pannus, and it can be aggressive. And that joint damage from untreated RA in the first 1 to 2 years can be permanent. You can't get that back. And this is what we see in our clinics. That's why we try so hard to get people in early who we really suspect have rheumatoid arthritis. And this is the part that's incredibly frustrating, not just to you, but also to your doctor, because the standard blood test for rheumatoid arthritis can come back completely normal, completely negative, even when all of this is happening inside of your joints. And we call that seronegative rheumatoid arthritis. And it's more common than people realize. It's one of the main reasons that people are dismissed and sent home with nothing. They're told there's osteoarthritis, wear and tear arthritis, but it could be this really aggressive condition. So what do you do about it? Here's the honest answer, and not the one you're going to find on a wellness channel. You can pursue lifestyle optimization. You can follow an anti-inflammatory diet, omega-3s, colorful vegetables, olive oil, less ultra-processed food that can reduce the inflammatory load in your body. The evidence is real. People feel better when they eat better, and they may respond better to treatment. But diet alone doesn't stop the autoimmune attack. It can kind of reduce that fire, but it can't put it out on its own. So this is why people with RA need disease-modifying medications, and these are drugs that actually halt the disease process at the immune level. So the goal is not just pain management, it's actually stopping that joint destruction. And it's a question that I often get from patients. They're like, well, what if I do this lifestyle choice? Can I make my RA go away? And the real answer is probably not, but you could really improve your overall outcome with RA, and maybe you won't need as many medications. The best outcomes that I see in my clinic are people who are doing both medication that controls the disease and the lifestyle habits that reduce that inflammation and support their overall health. It's not either or, it's both. And the lifestyle side is something you have real control over starting today. So if you're watching this and your hands look like what I've described, here's what I want you to do. If your knuckles are swollen, so right here, not your fingertips up here, and it's in both hands, and your morning stiffness is lasting more than 30 to 45 minutes, see a rheumatologist. That's who's really going to be able to help you with your diagnosis. Now, if you have psoriatic arthritis, though, it's a little bit different. It can actually affect the areas up here. But in that case, it could be either psoriatic arthritis, osteoarthritis, it could even be gout, but it's something to get checked out too. If you're confused, you're probably not the only one, and this is confusing even for other doctors. But rheumatologists know what they're going to look for beyond the standard blood test, right? We have to put together the pattern of where the location is. Do the blood tests make sense in this scenario? Could it be something else? Sometimes we do order imaging, x-rays, which hopefully are negative when we first get them, because that means that the damage hopefully hasn't been permanently done. MRIs can help look at early disease, and it could be just in your tendons, not even yet affecting your joints as much. Or we could do an ultrasound, and that's kind of more of a newer thing that we've been doing, and that can help with that diagnosis as well. Remember, having a normal rheumatoid factor in your blood test does not rule out this condition. And if you're not sure what you have, that's fine. That's exactly what we're trained to figure out. You don't need to come in with a diagnosis, you just need to come in. And yes, it can be frustrating because sometimes your diagnosis may change. And we may say that, okay, we thought it was rheumatoid arthritis all this time, but actually it's lupus. Psoriatic arthritis especially is important because it can not only affect the skin, but the joints. And actually it can also affect the eyes and other areas. Just like rheumatoid arthritis also, it's not just a joint disease, it's a system-wide inflammatory condition. A lot of people watching this have been told their labs are fine or that it's just aging, to take ibuprofen and come back in 6 months. While this might be the case for some people, it's not everyone. So if you really want an answer and something feels wrong in your hands and it's been going on for some time and nobody has given you a real explanation, trust the instinct. Get it looked at by someone who specializes in this. I have a video on rheumatoid arthritis, including seronegative rheumatoid arthritis, that I'm going to add over here, what it is, why it gets missed, and what you should ask for if you've already been dismissed. I'll link it above. I'm Dr. Neha with Plant Forward MD. I'll see you next time.